Welcome to Dementia-Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is part of our author series, Give Your Parents a Standing Ovation, Book Review and Discussion, sponsored by Prince George's County Government and the Department of Family Services.
My name is Dr. Gybrilla Ballard-Blakes, and I am the author of Give Your Parents a Standing Ovation. Next slide. Next slide.
I apologize if there's any lag.
Next slide. And you can go to the next slide, please. And pass that one too, please. Okay. My book is actually about caregiving for elderly parents. However, it's caregiving for anyone. I'm no stranger to caregiving. As a kid, my parents were caregivers for several of our elderly family members, our grandparents, and so on and so forth. So it showed us as their kids how to care for elderly people. Now, I'm one of 12, so I'm the 10th child. So we all were caregivers for our parents. And once my dad passed, they were living in South Carolina. And after the funeral, we all got together, the siblings, my siblings and I, and we tried to decide what we were going to do as far as caring for our mom. Our mom and my dad had been married for 60 years, over 60 years at that time. And they both were the only ones living in the home at that time. And once my dad passed, if we had not decided what we were going to do with our mom, she would have been in the house by herself. So when we started talking about what to do, I actually volunteered. None of my siblings said, you will do this. I volunteered to be my mom's caregiver, primary caregiver. Now, at that time, I was working full-time like most caregivers. I was working full-time. I was in school. I had a family. I was working part-time also as a professor. So I had a lot on my plate. But as kids, we were always told that by our dad, if anything had ever happened to him, to make sure that we took care of our mom. And so we had no other choice at that point. And the only thing I had to do at that time was to make sure that my mom was agreeable to come back with me to Bowie, Maryland from South Carolina. So once we asked my mom, she agreed to come back. So we packed up our mom, and as we were coming down the road, because as I said, I had so many things on my plate at the time, I wanted to try to figure out how I would be able to take care of our mom and do all the other things that I had to do. And I had no clue what caregiving was, even though we had seen it as kids and we were already doing it as our parents' kids. I was clueless as far as what caregiving was at that time. I had no idea that there were so many resources out here. I had no idea, like most of you that's on now, that I could sign up and possibly listen in on someone talking about caregiving. And there was a lot of resources and different things out there. I had no idea, and I don't think my siblings had any idea either. But still, I did it. And after our dad, after my mom came to live with me, she lived with me for a couple years before she passed. And during that time, it was tough, just like any other caregiver. It was very tough to be her caregiver and make sure that I was doing everything I needed to do for her. So by the grace of God, and that's all it could have been, I was able to do what I needed to do for her and continue doing what I had to do as far as my responsibilities, my other responsibilities. After our mom passed, I was lost. I was absolutely lost because one, I had put everything I had into caring for my mom and doing the other things I had to do, and I didn't ask for a lot of help. So, and I should have, but I did not ask for a lot of help. And I have 11 siblings, and I hardly asked for any help from them. I did it on my own, and I wasn't doing it because I didn't want help. I was doing it because I thought that was the right thing to do, and I was really letting my mom lead as far as if she wanted someone else to help out to do something, I would let that happen. So, so when I think about my book and the main reason for writing my book, it was for other people going through caregiving and trying to do the best that they can, and knowing that you really shouldn't go through it alone, and tap into all the resources that you possibly can. So no matter where you are on your journey of caregiving, you need to have a plan. I did not have a plan, but I survived. And I want to make sure that those of you out there who are caregivers, you do have a plan. Plan not only for the loved one that you're caring for, but also for yourself. Have some kind of idea or process in place to make the process a lot easier for you. Next slide, please. Okay. To act as a caregiver, as I said, it's really tough, but it's also the most important position or title that you'll ever hold. I really, regardless of any other position that I've ever held or title, being our parents' caregiver was one of the most prestigious titles that I can ever think of. I was so grateful to be able to care for our parents. And after my mom passed, when I wrote the book, it was really a gift to my parents to give them a standing ovation and honor the idea of being able to give them something back that was meaningful to them, and also meaningful to me and my siblings, to be able to give them something back, and by giving them something back and putting some of my trials and experiences and personal things into a book form, that it can possibly help someone else. And that was one of the main reasons for doing the book, is to ensure that other people will be able to grab a source and get ideas and see some of the things, see themselves in what I'm doing. Because when you're a caregiver, there's a lot of things that we do that's similar or almost the same. But one thing that we have to do is realize that the person that we're caring for, we are caring for them, but we also need to care for ourselves as well. Next slide, please. There are 9.5 million U.S. family caregivers, and that's increasing. That's from 2015 to 2020. And of those 9.5, 26% of those people are caring for people with Alzheimer's and dementia. Alzheimer's and dementia, family members or loved ones that you're caring for, that is a big one. Our mom started showing signs of memory loss in the early 2000s. And as time went on, we started to see that she was forgetting things more and more. So we did the right thing. We had her tested. We had our mom tested, and she tested for early stages dementia. And that was a little bit before my dad passed. And then because of my dad passing and transitioning over, it really took a toll on my mom. Because 60 years of marriage and always having someone beside you, and you're doing everything with that person, that took a toll on her. So caring for my mom, and she was beginning to show more and more signs of memory loss, and also she's heartbroken. That was a really, really tough one for me, as I'm sure anyone else out there who has loved ones who are either diagnosed with dementia or Alzheimer's, or just showing memory loss, you know, that can be even tougher, not only on the caregiver, but if you have kids in the house or neighbors or what have you, you're explaining a lot to try to make sure that they understand that if that person that you're caring for, maybe they're a little forgetful, or they're doing something that people might think are, not, it's not their normal, the way that they normally act. You're constantly trying to either explain that to them in a way, or you should be trying to explain that to them so that it doesn't affect the person that you're caring for. That person doesn't feel like there's something's wrong with them, and so that's a really hard one. Next slide. 61% of caregivers are females and 39% are males. We're seeing more male caregivers now because of a lot of different reasons. People are living longer. Men are stepping up doing the caregiving duties, as well as their wives and sisters and so on and so forth. So we're seeing an increase in men actually becoming caregivers. And that's why it's even more important to get resources and know that not to go alone. Ask for some help. Let people know how you're feeling, and take care of yourself, and make sure that you're not only just laser focused on the person that you're caring for. As you can see here, the average caregiver is a 49-year-old woman, and normally that woman is working outside of the home. As I said earlier, I wasn't that age. I wasn't that old at the time, but I was working. I was doing several things. But the average caregiver are still working outside of the home, and they're putting in 20 or more hours a week. As I said, I was putting in more time than that, and I was doing a lot. I wasn't just working outside the house, just one job. I was doing multiple things. So it was a really tough one for me. And as you can see here, unpaid family caregiving is estimated at $470 billion. That's a lot of money. But when you think about caring for your loved one, money normally isn't an object. And what's surprising is in my research, when I was researching about caregiving and doing things for to prepare for my book, to write my book, I ran across a law that said, a law that's in 30 states in the United States that says that adult children are obligated to take care of their parents. And that was strange. They're obligated to take care of their parents. And in some states, you could be sued for debt from your elderly parents if your parents are unable to take care of themselves. So there's a law out there in over 30 states, to include Maryland. Maryland, although the law is on the books, they repealed the law in 2017. So that's recently. And they repealed it because it's a law that's rarely used. And the reason why it's rarely used, because after Medicaid, states started to stop suing adult kids for their parents' debt. So that was kind of strange to me. That was one that I never heard of, and I'm sure some of you out there have heard of that before. But that law is a law that says that we as adult children are obligated to take care of our elderly parents. So that's one that you might want to look at, because in some states they're still suing adult kids for their parents' debt, especially Pennsylvania. Pennsylvania is one of the states that they're constantly sending lawsuits to elderly folks' children. Next slide, please. All right, this is one that's this is what we're talking about when we're talking about caring for our family, our loved ones, or our parents. The reversal of parenting. Most of us, we look at our parents when we're caring for them as a gift, because we're able, as I said, to give back. Some folks look at it as an opportunity to, now I'm going to tell my parents what to do, because now the roles have reversed. Well, if you look at my book, you'll see in chapter 2, the role can never be reversed to the point where you get the opportunity to rule your parent and tell your parent everything that they need to do. We need to realize and always understand that we're still the child. And the more that we push our parents to do things, the more that they're not going to want, for one, you to care for them, and they're going to push back. So this is a really big one when we talk about parent reversing the roles, role reversal. As long as we remember what our role is, and our role is to support them, to help and make sure that they have the best life at the end of their life, their lifespan, as possible. Because if we sign up, or if we, like I volunteered, or some people don't volunteer, some people it's put in their lap. They just, there's no one else for them to go to. So you have to be their caregiver. Even if that's the case, we always should remember to give our parents respect and understand that although the roles have reversed, you're doing you're taking them to doctor's appointments, you're giving them meds, you're washing clothes, you're doing all the things that our parents did for us. We always should remember and give our parents respect. They are still our parents. And their quality of life at that point, when they're unable to do things for themselves, we should think of respect and improving their quality of life, and not feeling as though here's my opportunity to get them back for all the things that they made me do, and all of the veggies they made me eat and all that stuff. That's not the time to do that. So this is a big one. Make sure that we understand that we're still the kids. Next slide, please. All right. I talked a little bit about this. This is in my chapter 6. It's very important. It doesn't matter what you do, what hat or what mask you put on. It's very important. And it's important to make sure that you as a caregiver take care of yourself. And the reason why you need to take care of yourself is because if something happens to you, more than likely you are the only person that's able to take care of your parents, or that your parents want you, have chose you to take care of them. So if you don't take care of yourself, and you're laser focused on just taking care of that loved one, whether it's a parent, whether it's a spouse, or whoever that person is that you're caring for, if you're not taking care of yourself, if something were to happen to you, who's going to take care of that person? So you should always think, I have to take care of myself as well. So I have to do little things for me, but I have to make sure that there's where that plan comes into play. You should have a plan. You should have other people in that plan that can support you. You should tap into some of the support groups. You should make sure that if there's a respite program or organizations that help with caregivers when they need a break, check those opportunities and those organizations to make sure that you're getting that break. Caregivers, we need a break. I don't care how good you are as a caregiver. From my experience and all of the caregivers that I've spoken with throughout the years, caregivers, if we don't take time for ourselves, we will not be able to take care of the person that we're caring for. Next slide, please. And here's why. If you look at this, 23% of Americans say that their health is worse after they became a caregiver. And why is that? Exactly what I just said. It's worse because you're under so much stress. It's challenging. It's a blessing to be able to do it, but it's a very challenging job to have. But you have to protect yourself so that your health doesn't fail. And you can do that. And I can tell you can do that because I did it. And the way that I did it was, and like I said, I had no idea. I didn't know that all these statistics were out here. I didn't know that being a caregiver could worsen your health and all that. All of the things that I did, along with being a caregiver for my parents, my mom, I still made sure, even if I had to bring my mom along, I took care of, I took a break. I meditated. I prayed a lot because I knew that the only way I could get through what I was doing as far as caregiving, I had to have some help from a spiritual being. So I made sure that I meditated. I when I felt like I was like at the end of the rope, I was stressed. I didn't know which way to go. I took a break. I made sure that I listened to my body, and by doing that, I think my health. I kept my health. But if I hadn't have done that, if I kept pushing, because there was so many things to do when I was a caregiver for my mom. Now, as I said earlier, my mom and my dad was in South Carolina. So in order for me, my mom's doctor was in South Carolina, and I didn't want to change that because, as most of you know, as caregivers, you don't want to do a lot of changing when it comes to our elderly loved ones. You want to try to keep things as normal as possible. So although we moved my mom back to Bowie, we kept her house there so we could take her back there every now and then so she could see the house and live in the house and so on and so forth. And I kept her doctor there in South Carolina. I took her back when she had a doctor's appointment. We drove all the way to South Carolina for a doctor's appointment. We stayed in the house for a couple of days and we came back to Bowie. But I didn't want to change her doctor because she was accustomed to that doctor. She would listen to the doctor. Her health was very good. The only medical problem that our mom had was the dementia. She had no other medicine. She didn't have to have any other kind of medicine. So she was very healthy. But I think she was heartbroken, and then the touch of dementia with that pretty much caused her to transition. Next slide, please. In 1999, also a study showed that 63% or higher a mortality rate of caregivers rather than the non-caregivers. So it tells you have a 63% of dying as a caregiver versus if you're not a caregiver. So that lets you know there's a lot of stress. Get respite, ask for help. Don't go it alone. I know it's your spouse. I know it's your mom. I know you feel as though it's your job, but guess what? You can get help. You can still have someone help you. I have my oldest sister. She's a caregiver for her husband, and we talk to our oldest sister all the time about having us or someone help her. She's like any other spouse. She wants to go alone. Now, what we do, we're kind of pushy with her because we know we're watching her health. We're watching her. She lives in Lawrenceville, Virginia. We're in Maryland, in Virginia. But we make sure that we talk to her and try to get her to have someone else help her with her husband. From time to time, every 2 months, I'll take someone, a hairstylist from Maryland, all the way to Lawrenceville, 3.5 hours to have her do my sister's hair, just to give her a break, just to sit there and have lunch with her or breakfast with her or whatever. So if you see your loved ones and they're caregivers and they're taking care of their loved one, support them, help them, and try not to let them go alone. Now they're stubborn because our older sister, she's very stubborn, but we're a little pushy. We're trying to get her to understand we need to help her. Don't go it alone. So, and also the Stanford University study shows that 40%, as I mentioned before, of Alzheimer's caregivers die before the person that they're caring for. And you ask yourself why? It's the stress, and it's the stress related. Stress. And I'm going to talk a little bit in a few minutes about some signs of stress. It's things that you can do. Next slide, please. Also, caregivers, you have a higher risk for health and emotional problems. So not only your health, but, as I said, it is so stressful. I was so stressed as my mom caregiver. I was happy. I kept up with my medical appointments, and I would talk to my doctor a little bit about my stress and different things like that. But I made sure that I continued to take care of my health as well. And it's amazing that I did that, because I absolutely had no idea that being a caregiver was so stressful other than experiencing. And I guess experience is the best teacher. So I'm so happy that most of you are on this webinar this evening, and hopefully you'll get something from the webinar that will support what you're trying to do and help you on your journey, and help and make sure that what you're doing is a lot easier than what I had to go through. Next slide, please. Here are some signs. Here's some signs of caregiver stress and depression. Here are all the signs here. Not all of them. Here's some of the slides. We'll have a couple of the next slide. And look at some of the things here. And I'm almost positive, if you're a caregiver, you have experienced some of these signs here. I experienced some of these signs. But be aware of the signs and get help. Ask your doctor about them. Take a break. Ask for some help, because this can lead to your death or very poor health. And you don't want that, because if something happens to you, as it said, who is going to take care of that person that you are caring for? Next slide, please. Here's some other signs here. Anxiety. That's a big one. A lot of anxiety because we want to do our best. And especially if we have someone who's a little pushy. Sometimes elderly folks can be a little pushy. And you're trying to do the best you can, and it's just not enough, or it's not what they want you to do. So you can have some anxiety. You can also feel worthless, and the guilt. Caregivers don't feel guilty. Don't feel guilty about taking a break. A lot of caregivers feel guilty if they take a break, because they feel like nobody should be taking care of that loved one except them. They should be the only person taking care of them. So if I go out and get a movie or go out to dinner or whatever, if I'm not there with that loved one, I feel guilty. I tell you, I feel guilty. I actually felt guilty anytime I did something away from the home, even if I had to travel. And we were blessed with our mom, and this is something else that's very stressful. When you are the caregiver and you don't have someone to back you up, like a caregiver to come in and give you a break or whatever, so you have to do it all. We were blessed because we had a family friend, a close family friend, who traveled with my mom and I when I needed her to. If I needed her to stay over night because I needed to go somewhere, travel or what have you, she was there. My mom loved her, and that's a big one too. The people that we get to take care of our elderly parents and our loved ones, they have to be people that they are comfortable with and that they like. If it's not, you have to find someone else, because the worst thing you want to do is to stress that person out as well, because you're leaving them with someone, and then they start to feel like that they're being a burden to you. And that's something that we worked as hard as we could to make sure that our parents never felt like they were a burden to us, because we understood that they took care of us, and so it was our job to take care of them without giving them that I'm a burden on my kids, and I need you to do this, that, and the other. I made sure that my mom knew that I was blessed to be able to give her my time, or any time I had. I mean, just like women can understand what I mean when I say this. When you have a new baby and you're working outside the house and you have to work, and when that work day is over and you're on your way home, you can't wait to see that baby. You can't wait to hug that baby. You can't wait to do stuff with that baby. That's how I felt. I felt like my mom was a new baby for me. When I got off of work and when I was on my way home, I couldn't wait to get there to see my mom. First of all, I wanted to see. I always did I always did a check of her emotions to see how she was doing, how she was feeling. I would call her during the day, but I always wanted to look at her. So I couldn't wait to get home to my mom. But a lot of that was guilt too. I can tell you, a lot of that was guilt. So these are the things. Be very careful when you're feeling these, but also know that it's normal. It's normal for you to feel these things, but you should get help because it's things that other caregivers are experiencing as well. Next slide, especially the last one, thoughts of death or suicide. If you're thinking about suicide or death, you have to talk to someone. Don't have those feelings and not get help for that. That's a huge one. Some tips to be a successful caregiver. The National Family Caregivers Association offers a couple tips for us. The first tip here is, of course, choose to take charge of your life. I just talked about that. Don't just be laser focused on the person that you're caring for. You have to take a break. Take that break. Next slide, please. This is also a big one. The job that you're doing as a caregiver is a hard job. It's a very hard job. So you actually deserve some quality time to yourself and for yourself. You deserve it. But when you do that, you definitely need to make sure that the person that you're caring for are continuing to have someone there to take care of them. You can't just say, I need a break, I need some quality time, and this is my time, and not make sure that person is okay. You have to do that too, but you have to remember that you can't just stay laser focused. Next slide, please. Again, watch out for those signs we just talked about. Watch out for those signs of depression. Don't delay getting help, especially if you're thinking about, that's a big one. You're thinking about death or suicide. You should never feel that and not get help. Get help if you're feeling that. Again, if you're feeling that, if you're at that point, you are not an effective caregiver at that point because you are totally stressed. So please get some help if you're feeling that way, that strongly about what you're doing in your job and everything else that's going on in your life. It's a hard job. It's very challenging. But if you step to the plate and you're doing it, use the resources. At the end of this webinar, I have a ton of resources for you. I can almost guarantee you the resources at the end of this webinar will answer almost every question you have, with the exception of maybe one or two. And the ones that are not there, you can use the resources that I have at the end of the webinar to get those questions answered. So sitting through this webinar, you'll have a lot of resources at your fingertips. Next slide, please. Again, take the help. Take the help. Someone's offering you help, take the help. The only time you can't take the help if it's help from someone that your loved one don't want be taking care of them. But it doesn't always have to be the person taking care of the person you love, your loved one. It could be help such as going to the grocery store for you, getting medicine for your loved one. It could be all kinds of stuff. Maybe helping you with some house chores. There's all kinds of things that people can help. Maybe taking someone to get your hair, bringing someone to your house to have them do your hair, do your nails, whatever. Or if you're a guy, give you an opportunity to go out and get your hair cut or whatever. But make sure that you're accepting people's help. Don't go alone. It is not your total responsibility to take care of that loved one. Get you some help. If you want to be effective and know that you're effective, get that help and educate yourself about the person's condition. That's very important. Because if you're caring for someone and you're not going to the doctor with that person, you don't know what kind of medicine that person is taking and when that person should take that medicine, then actually you're not really doing all of the caregiving duties. You have to be educated about what the condition is of that person that you're caring for. Next slide, please. And there is a difference between caring and doing. So be open to new technology. If you can get a monitor for your loved one, so that if you're not there and there's an emergency or whatever, your loved one could push the button and get some help. Or if you're dealing with a loved one with Alzheimer's and dementia, you want to make sure that you have some kind of technology or some kind of bracelet or identification on that person, especially if that person is a wanderer. If that person will leave and go off and get lost, you want to be able to. And there's so much technology out there. There's no reason to not have something that is on the loved one or the person that you're caring for, a friend or what have you, that can help you find that person or law enforcement find that person if that person is missing. And always trust your instinct. Most of the time, your instinct is right. So if you feel that you're just overwhelmed, more than likely you are overwhelmed. Take a break. Get some help. Have someone give you some respite. Next slide, please. And this is seek support. As I said, seek support from other caregivers. Other caregivers are some of the best resources because they're going through what you're going through, or they can possibly give you respite. You can possibly trade off on each other. You can take care. You can help them get a break, and they can possibly give you a break. They can share some resources with you, and you can possibly share some resources with them. The biggest thing of all is, you know, that if there are other caregivers out there and you're talking to them and you're socializing with them and you're joining groups, you're understanding that you're not alone. Because a lot of caregivers feel that they're the only one in the world that's going through some of the struggles that they're going through. I was one of them. I thought, I looked around at my friends and I didn't see them, they weren't caring for their parents. And as I said, at that time, I really didn't know much about caregiving. I thought we were just doing what we had to do for our mom. Now, I thought I was alone. I thought I was the only one that was going through some of the things that I went through. And that's some of the reason why I think I never asked for help. I thought that what I was going through was not normal. And what all I wanted to do was to make sure that our mom had the best care, and I kept her as happy as possible. That was my goal. Next slide, please. This is huge. I know I keep saying this is huge. This is huge. Dealing or getting along with family members. As I said, I'm one of 12, and let me tell you, I understand this so much better after the fact. During it, I did not understand this because, again, I was laser focused on caring for my mom. I had so many other things that I was doing, so I definitely didn't. I had all those resources out there, and I wasn't using my resources. As I said, I didn't have a plan. Okay, I didn't understand that when people's parents, or when you need to be a caregiver for your parents, it's very emotional for every sibling and every family member. It's emotional. It's emotional. You think that you're the only one that's emotional at that point, and you just forget that there's other folks out there sometimes. So understand that there's a lot of emotions going on because people are not normally, you normally don't have to take care of your parents. You look at your parents as caregivers for you. They're the ones with all the answers. If you need something, they're the ones that you go to. You don't think about having to care for them. So when it happens, such as when it happened to us, we were very emotional. We couldn't understand why these strong people that had raised the 12 of us and have done all these great things, and now they're weak and we need to take care of them. Okay? So also a big one, keep your siblings informed as much as possible. And that's important, very important, because a lot of times you're doing so much. There's not a lot of times you can call, especially if you have as many siblings as I have. I have 11 siblings. So it would have been difficult for me to call every sibling every day and tell them what was going on. But what I did, any sibling that wanted to know, any sibling that called and needed information, I made sure that they were kept aware. And Don't play the blame game. That's a big one. I hear that a lot about siblings. The blame game. We did not do that. We did not do the blame game. My siblings and we did not do that. We did not blame anyone for not doing something or whatever, because we understood and we know each other. If siblings want to help, they will help. If siblings feel that you need help, they will help. And I know my siblings, and I know when I was taking care of my mom, and they saw how happy our mom was and what we were doing. From them on the outside, it looked like it was very easy. As I said, none of us really knew what caregiving was, but we knew that our dad's directive was, if anything ever happened to him, take care of our mom. So we knew that we were going to do that. But, and to know how difficult it was, none of us knew that. Okay? But so there was no blame game. So when you do the blame game, that only brings about more stress. If you are focused on taking care of your parent, don't worry about your siblings. Even though you see them out doing whatever, or you feel like they're having fun and you're there taking care of your parents, that's okay. That's all right. As long as your parent is happy, as long as you can do it, continue doing it. And now that you know that there's so many other resources out there, you can tap into a lot of resources. You really don't have to have a bunch of family members. But if you do, especially as many family members as I have, you need to tap into some of those family members. Don't go it alone. Get some help. Ask them for help. I don't think there's one of my siblings that I would have asked to do anything that they could do that they wouldn't have done. So don't do the blame game. Be open and willing to accept help, as we said before, and suggestions. Some people feel very needed when, or they feel that their opinion, some people need to feel that their opinions count. And some people feel that if you're not taking their advice, or you're not listening to them, especially if they're family too, that you're wrong, and that can cause a lot of problems. So listen to what they're saying to you. Some of their suggestions you can use. As long as there's something that you can, it's not a problem with you doing, it's not costing you anything. And if it's costing you anything, if they're willing to support that, use some of their ideas. Let them join in. Let them in. Be open to that. And don't worry about what your siblings are not doing to help. You don't worry about that. Your whole thing is to take care of your parents. Because if you're sitting there, I hear a lot of siblings they're having arguments and disagreements and not liking each other because they feel that sibling isn't doing anything and they're doing it all. That's not what a caregiver should be, and that's not how you should feel about your siblings. Try to understand why they're doing what they're doing and ask for help and find out from your parents if that's what they want. Because sometimes your parents might not even want anyone else to help. You need to find that out as well. Next slide, please.